Welcome to Community Health Briefs, where AI hosts share short, clear stories about research shaping healthier futures. Each episode highlights new work from members of the College for Community Health at Montclair State University, showing how ideas connect to the social and structural forces behind health. In short, this is research you can trust, explained by AI in minutes.
Imagine getting robbed by a stranger on the street. I mean, it's terrifying, right?
Oh, absolutely.
But now, imagine getting robbed by your own bank. Or, think of a firefighter who deliberately sets a house on fire.
Wow, yeah, that completely flips your sense of reality.
Right. One makes you fear a dark alleyway, but the other makes you question the entire concept of safety. What happens to our health when the very institutions designed to protect us become the ones causing harm?
Huge question.
Okay, let's unpack this. We are looking at some seriously eye-opening research.
Yeah, this one really stuck with me.
We're exploring the work of Dr. Melody Benedict. She's an assistant professor and a critical scholar activist at Montclair State University's College for Community Health.
Right, in the Department of Social Work and Child Advocacy.
Exactly. And she worked alongside Drs. Nelia Quezada-Horn and Autumn Asher-Blackdeer. Their paper tackles a tough reality, which is that social work and healthcare institutions often betray the marginalized communities they exist to serve.
They do. And instead of upholding justice, these systems, they frequently minimize harm and reinforce historical biases.
Which is the exact opposite of their mission.
Right. And that doesn't just fail clients. It actively deepens the trauma for both the people seeking help and, the practitioners trying to provide it from inside a broken system.
The researchers actually call this institutional betrayal. So going back to that firefighter analogy, how does the psychological impact change when the supposed protector becomes the threat?
What's fascinating here is a framework the researchers use called betrayal trauma theory.
Betrayal trauma, okay.
Yeah. When a stranger harms you, you process it as an unpredictable external threat. But when an institution you literally rely on for survival, like a hospital, a school, or child welfare, violates your trust,
It has to be devastating.
it creates profound psychological confusion because, you are forced to rely on the very system that is hurting you.
To figure out how this plays out day to day, the research team didn't just crunch data in a lab. They actually interviewed everyday social workers navigating these systems.
Right. People behind the scenes in clinics and schools.
Yeah, to see how this harm functions in practice. And they found it shows up in everyday health experiences, often disguised as standard procedure.
Oh, absolutely. Like, consider the social determinants of health, like living in deep poverty.
Right.
If a patient misses appointments because they work 3 minimum wage jobs and don't have a car, the institution often flags their chart with a label like non-compliant or defiant.
Wait, let me push back on that a little bit. If a patient is genuinely missing appointments, isn't non-compliant just an objective medical reality? Like, how is a doctor supposed to treat someone if they can't accurately record what happened?
It seems objective on the surface, sure, but it actually places the blame entirely on the individual for the failures of a broader system.
Oh, I see.
It tells a struggling mother, you are the problem, rather than asking what systemic failures put you in this impossible position.
It totally ignores the context.
Exactly. And when people are labeled with these deficit-based terms, they feel alienated, they feel judged. So the tragic result is they just stop seeking health care altogether.
Which completely devastates community health. So how does a massive, slow-moving bureaucracy actually fix that? A nice PR statement isn't going to change the DNA of a hospital.
No, not at all. So the researchers propose an 8-step framework called the Institutional Trust Restoration Model.
Okay.
If we connect this to the bigger picture, fixing this requires what the authors call institutional courage. It takes concrete action, starting with an epistemic transformation.
This sounds very academic. What does that mean on the ground?
It just means totally shifting the lens. A social worker has to be trained to stop viewing clients through historical biases and start seeing the actual power dynamics in the room.
Okay, changing the foundational mindset makes sense. But they also emphasize community-rooted practice. Does that just mean, like, asking locals to fill out feedback forms?
No, it goes much deeper. It involves partnering with grassroots organizations and deliberately creating physical and emotional spaces for healing and joy.
Wait, joy. In a bureaucratic setting?
Yes. Joy is treated as a necessary active ingredient in the healing process, not just an afterthought.
I really love that approach. But Mindset shifts and joy don't rewrite bad policies. Which brings us to their call for structural accountability.
Right, the real heavy lifting.
The paper talks about conducting real equity audits because from what I've seen, most corporate audits are just surveys that end up sitting in a drawer somewhere.
And that is the difference between performative action and actual institutional courage. A real equity audit isn't a simple survey.
What is it then?
It's a mechanism that forces the institution to be transparent. It means publicly tying funding, or policy decisions, directly to community health outcomes.
So legally binding them to put their money where their mouth is.
Exactly. Proving that they aren't just repeating past harms.
So what does this all mean? The core takeaway here is that trust isn't automatically granted just because an agency puts up a sign saying they care.
No, it has to be earned.
Right. Actively earned and maintained through transparent, community-centered action.
That's the only way forward.
So think about the institutions you rely on for your own health and safety. If they ever fundamentally broke your trust, what specific measurable actions would it actually take for you to ever let them help you again?
Thanks for listening to Community Health Briefs. This podcast was created with the help of AI, verified by the paper's author, and does not necessarily reflect the views of the College for Community Health or Montclair State University. Thanks again for listening, and stay tuned for our next episode. Make sure to subscribe and check us out at www.montclair.edu/CCHL to learn more about us and the amazing work we're doing for community health.